I got involved with vein care because being an internist for over 20 years in a metro area, Chicago being, I think, one of the third largest city in the United States, with a lot of problems, in the population that I serve, with a lot of serious medical problems, obesity being one of them, heart failure and other things that I treat. Swollen legs was a big problem for me to deal with it, from the medical standpoint. And I had to figure it out things, why was it that they had leg swelling? And was it just kidneys or heart or liver, or was something else? And something else is either lymphatic or veins. So I was forced to send patients to other centers to trying to figure out and treat vein disease. And it was a very cumbersome task for us, since we're a primary care clinic. So I decided to get involved with the treatment and diagnosis of vein disease. And in a relatively short period of time, I've been able to incorporate both diagnosis and treatment of vein disease into the general approach of an internist. Well, my background, I did my medical school in South America, in Colombia. So I'm very proud of the fact that we did a lot with our fingernails. So they do train us very well because we have to do a lot of things with minimum resources. So our degree is doctor and surgeon. So I was doing a lot of surgeries as a medical student and as an intern in Colombia. So that gave me the basis to have the skills to be able to do some invasive procedures. So when I did my training at the University of Illinois in Chicago, being the first Latin ever being there, foreign graduate, I had a lot of advantages going through Jackson Memorial in Miami, a big regional center, and having a lot of experience in invasive procedures such as central lines and so on, access of big vessels without any ultrasound guidance, old-fashioned way. The technique itself to actually acquire the vein, it's a Seldinger technique, which is something that we learned many years ago, and we did it without the guidance of the ultrasound. So having the understanding of what is it that you're doing surgically wasn't that difficult for me. I already had the background, so it was just a matter of getting the technique to be able to visualize the smaller vessel under ultrasound guidance, which for me was a luxury, and to understand the anatomy, because not everybody knows the anatomy of the superficial venous system. So you have to learn the anatomy. It's important, and I'm still learning, but I understand very well what I need to do and what the things that I need to avoid. So it's a process that I've been doing, and I have been able to successfully treat patients with very complicated diseases. And as far as the other aspect of doing the care, now with the Dr. Klein's invention of the tumescent anesthesia, it makes it even easier because we have to avoid doing epidural anesthesia or general anesthesia and so forth and so on. So make it very available and convenient for a primary care physician with certain skills to be able to be trained in these kind of things. Of course, I did some classes, some courses, learned how to, I took a intensive course in ultrasonography, and I've been training myself for 20 years doing my own ultrasounds and so on. And also training the users of laser. The company provides some training and so on, and with the help with experienced sonographers, is able to actually get very comfortable with the procedure.